If you're troubled by your voice and it sounds hoarse, then that can be pretty frustrating. So if that is something that you are struggling with, you should listen to this video. First, we need to speak and learn how our vocal cords work and how we get our sound out. So the air gets expelled from your lung, pushes through the vocal cords, and the vocal cords move more from an open position to a closed position. And the vocal cords will then start vibrating. There's a ligament around which we have a gelatinous layer called superficial laminar propria that will generate a what we call mucosal wave around the ligament, and that gives us the smoothness of our voice and will allow us to sing. Now if this layer, superficial laminar propria, doesn't vibrate, then we have hoarseness. Now there are essentially two broad categories of hoarseness or conditions causing hoarseness. One is a functional problem called muscle tension dysphonia. Essentially the neck muscles and the small voice box muscles, and there are about 7 inside your voice box, are tightening up too much. They're not allowing the vocal cords to vibrate freely, and that makes the vocal cords become very stiff, and that mucosal wave I alluded to earlier is not vibrating smoothly around the vocal ligament. Typical symptoms include vocal fatigue. Let's say at the end of the day, you would feel quite tired and you just don't want to talk. There's also tenderness around the neck. So when you grab your neck right around here and squeeze in that area, you may feel some tenderness, and those are signs of muscular inflammation. If that is what you're struggling with, then you should look for a good speech therapist who can address those issues. Muscle tension dysphonia often arises from overusing your voice. That may be as part of your job. The other broad category besides the muscle tension is related to structural changes of the vocal fold. We can have vocal cord nodules form. Those are seen again from voice overuse, ultimately turning into scar tissue, forming nodules. And this will prevent people from transitioning to a higher pitch, and the voice will ultimately develop a vocal break or pitch break.
Very soft enough.
Now, if you're diagnosed with vocal cord nodules, it's possible that you can only salvage that with a surgery where we perform a photomicrosurgical resection under a microscope to remove those nodules very carefully by essentially peeling the scar tissue away from the undersurface of the epithelium while protecting that superficial laminar propria. Other conditions are vocal cord polyp. That's different from a vocal cord nodule. Polyps are often seen on one side and not on both sides. And you may recall that Adele had such a polyp and ultimately had to undergo vocal cord laser surgery to remove that polyp. Other conditions that may cause hoarseness are vocal cord bleeds, where the blood vessels within the vocal cord ultimately shear and pop, and they will bleed into the vocal cord, not allowing a normal mucosal wave to develop, causing hoarseness. Now, if that is the case, we would also use a laser to ablate and remove those blood vessels that can easily bleed again, and there could be scar tissue or just plain loss of that important superficial laminar propria after surgery. You may recall the actress and singer Julie Andrews, who underwent surgery, and during the surgery, large portions of that very important layer, the superficial laminar propria, were removed, and unfortunately, that injury was career-ending for Julie Andrews. So let's summarize. When you have a hoarse voice, then you may either suffer from a functional problem called muscle tension dysphonia, where your muscles tighten up too much, and that could benefit from speech therapy, or you have a structural problem along your vocal cords, such as nodules or polyps or bleeding blood vessels that may require a surgical intervention to be resolved.